Gigantism. Definition. Gigantism is the disorder in which excess amounts of growth hormone are secreted from the pituitary gland during a person's childhood. It occurs before the epiphyseal, growth, plates of the bones have come together and fused.
Gigantism, also known as giantism, is a condition characterized by excessive growth and height significantly above average. It is a rare disorder resulting from increased levels of growth hormone before the fusion of the growth plate, which usually occurs at some point soon after puberty.
Causes. A pituitary gland tumor is almost always the cause of gigantism. The pea-sized pituitary gland is located at the base of brain. It makes hormones that control many functions in body. When a tumor grows on the pituitary gland, the gland makes far more growth hormone than the body needs. There are other less common causes of gigantism. McCune-Albright syndrome causes abnormal growth in bone tissue, patches of light brown skin, and gland abnormalities. Carney complex is an inherited condition that causes non-cancerous tumors on connective tissue, cancerous or non-cancerous endocrine tumors, and spots of darker skin. Multiple endocrine neoplasia type 1, MEN1, is an inherited disorder that causes tumors in the pituitary gland, pancreas, or parathyroid glands. Neurofibromatosis is an inherited disorder that causes tumors in the nervous system. Sign and symptoms. If the child has gigantism, he/she is much larger than other children of the same age. Also, some parts of their body may be larger in proportion to other parts. Common symptoms include very large hands and feet, thick toes and fingers, a prominent jaw and forehead, coarse facial features. Children with gigantism may also have flat noses and large heads, lips, or tongues. The symptoms child has may depend on the size of the pituitary gland tumor. As the tumor grows, it may press on nerves in the brain. Many people experience headaches, vision problems, or nausea from tumors in this area. Other symptoms of gigantism may include excessive sweating, severe or recurrent headaches, weakness, insomnia and other sleep disorders, delayed puberty in both boys and girls, irregular menstrual periods in girls, deafness. Diagnostic evaluation. The condition may be diagnosed in a child from a blood test where levels of growth hormone and insulin-like growth factor, IGF-1, are noted to be elevated. An MRI scan or CT scan can show if there is a pituitary adenoma, tumor, present. It is often caused by this benign non-cancerous tumor of the pituitary gland causing oversecretion of the growth hormone. During an oral glucose tolerance test, child will drink a special beverage containing glucose, a type of sugar. Blood samples will be taken before and after child drinks the beverage. In a normal body, growth hormone levels will drop after eating or drinking glucose. If child's levels remain the same, it means their body is producing too much growth hormone.
Finding a specific genetic cause for gigantism has proven to be difficult. Gigantism is the primary example of growth hormone hypersecretion disorders, a group of illnesses that are not yet deeply understood. Two specific mutations in the IPE gene have been identified as possible causes of pituitary adenomas. These mutations also have the ability to cause adenoma growth to occur early in life. This is typical in gigantism. Additionally, a large variety of other known genetic disorders have been found to influence the development of gigantism, such as multiple endocrine neoplasia type 1 and 4, McCune-Albright syndrome, Carney complex, familial isolated pituitary adenoma, X-linked acrogigantism, X-lag.
Management. Surgery. Removing the tumor is the preferred treatment for gigantism if it's the underlying cause. The surgeon will reach the tumor by making an incision in child's nose. Microscopes or small cameras may be used to help the surgeon see the tumor in the gland. In most cases, child should be able to return home from the hospital the day after the surgery. Medication. The doctor may use the drugs octreotide or lanreotide to prevent the growth hormone's release. These drugs mimic another hormone that stops growth hormone production. They are usually given as an injection about once a month. Bromocriptine and cabergoline are drugs that can be used to lower growth hormone levels. These are typically given in pill form. They may be used with octreotide. Octreotide is a synthetic hormone that, when injected, can also lower the levels of growth hormones and IGF-1. In situations where these drugs are not helpful, daily shots of pegvisomant might be used as well. Pegvisomant is a drug that blocks the effects of growth hormones. This lowers the levels of IGF-1 in your child's body. Gamma knife radiosurgery. Gamma knife radiosurgery is an option if child's doctor believes that a traditional surgery isn't possible. The gamma knife is a collection of highly focused radiation beams. These beams don't harm the surrounding tissue, but they are able to deliver a powerful dose of radiation at the point where they combine and hit the tumor. This dose is enough to destroy the tumor. Gamma knife treatment takes months to years to be fully effective and to return the levels of growth hormone to normal. It's performed on an outpatient basis under general anesthetic. Complications in gigantism. Treatment of the condition can lead to metabolic problems including with glucose and lipid metabolism. If not treated, the heart can enlarge, leading to cardiovascular problems later in life.